We'll move to Uganda now, where patients continue to be turned away from government hospitals across the country. In Uganda, no thanks to the ongoing health workers' strike, which has left many with a range of medical conditions, some critical, and sometimes very, very, very troubling. Prime Minister Robina Nabanja has lashed out at striking health workers and said that the government is sick and tired of working under immense pressure from civil servants.
Now, Ms. Nabanja, who was commenting on the ongoing health workers' nationwide sit-down strike, threatened to use her power to sack defiant healthcare workers. Meanwhile, the Public Service Minister, Mr. Wilson Muruli Mukasa, says that the government is calling upon allied professional health workers, nurses, and midwives to return to work on Monday. Failure to do so, all these workers will be considered as having abandoned duty and resign accordingly, or will be urged to resign accordingly. Now, joining us in this heated situation in Uganda is our East African correspondent, Abdinor Aden. Good morning, Abdinor. Good to have you. All right, let's get into it, Abdinor. The Prime Minister of Uganda, Ms. Robina Nabanja, while commenting on the ongoing health workers' nationwide sit-down strike, threatened to use her power to sack defiant healthcare workers. What do you make of the statement?
Well, indeed, you can understand making the statement as they celebrated the martyrdom of St. Andrea, in one of the districts of Uganda. Basically, the pressure was indeed too much to bear with patients stranded at medical facilities for the last 3 days. And this is something that has been of growing concern to the government, because health is indeed one of the strategic services and sectors for the government.
Okay, I mean, bring us up to date, with the reasons for the growls of these health workers that has, of course, led to the downing of tools nationwide. Has it changed from the upward review of salaries that they initially were demanding? Is there something else?
Well, before that update this morning, when the president of the Ugandan Nurses and Midwives Union, Mr. Justice Jerome, called on his members to call of their strike and resume operations, a call that continues to face resistance from its members, because in 2017, Ugandan doctors and medical fraternity had a similar strike, because the doctors then, the lowest earning $250 and the highest $1,000, not much has changed since then. Because as we speak currently, doctors or medical service providers with a certificate are earning $400, and the highest are earning approximately $1,300 as per the latest currency rates. We expect the situation to develop out, whether the doctors will fully accept the call of their person.
All right, Abdinor, let's talk about the deadline. The health workers have been given till the end of today to return to work. Do you see the possibility of this happening?
Well, there might and there might not be, because several members, because this is not only a representation of one section, they have different needs, different complaints. And we faced a similar situation in Kenya the last 2 years. And even as we speak, people are working, the doctors and medical professionals are working, but with less motivation, because the bargaining agreement has not yet been signed. Even if the doctors have refused to listen to the call given by President Jerop, because they say, we will not accept, because we have the government has not implemented the collective bargaining agreements of 2018. Therefore, unless their conditions are met and the government uses other approaches, which we understand might involve forces and dismissal of the medical professionals, as at now, all indications are they might not go back to work.
All right. I also want to talk about something, because I read through this, the story, and there's also reports that the Ugandan Nurses and Midwives Union might be pulling out of the strike. I'm not sure how true that is. But of course, like you said, there's different demands that might be leading to the strike. So can you highlight on some of these various demands, and the likelihood that the nurses and midwives might pull out of the strike?
Yeah, as you mentioned there, the EMU, as the abbreviations put, they have made an agreement with the ministry, and the date set as 16th of June, which is approximately 3 weeks away. So that is the revised salary structure, which is expected to be released. But their worry is that they're not guaranteed because if we speak about the neighboring Kenya, we've had similar situation in the past. An agreement was made, pledges were made, but they were not met. Again, worsening the situation. Therefore, unless the Ugandan government has a way of guaranteeing the doctors that indeed it shall implement the pledge it has made, the doctors shall remain, and the midwives and the nurses, in general, the fraternity might be serving with some and concerns.
All right, thank you very much, Abdinor. We'll be looking to connect with you again to find out updates. By the end of the day, I'm sure we certainly would have updates about the story.
Absolutely, and I'm continuing to follow the story keenly because it's a matter of huge interest for the East African region as well.
Absolutely. And of course, the Ugandan people, will, be put through troubling times until this is settled. Thank you very much, Abdullah, once again, and wish you a great Monday ahead.
Thank you.